Now, they give an example. A woman who has tolerated her diastolic pressure of 120 for 10 years without symptoms or deterioration does not need immediate hypertension. This means the second number, the overall resting blood pressure of her system, if it's 120, why would you even lower it? How do you know what's normal on her? You don't. What if she smokes cigarettes? What if she has atherosclerosis? What if she has plaquing in the arteries? Does she require a higher blood pressure? This medical text says she may. Marked elevations in systolic pressure with little or no rise in diastolic does not constitute an indication for depressor therapy, which is drug therapy. This is particularly true in elderly with arteriosclerotic patient, this is hardening of the arteries, even though diastolic pressure may also be moderately elevated. So they're saying you got to know when to lower it and when not to. Does that make sense? Yes or yes? It does. It does. Now, does cholesterol clog arteries? Yes. Survey says, if it clogs arteries, why doesn't it clog the small ones? Anybody? Anybody? I'm sorry, if it clogs arteries, why aren't people walking around with black fingers and toes? Oh, they're not. Why doesn't it clog veins? Oh, so does cholesterol clog arteries? No. No, understand, we got to look at the structure of arteries first. If I was to cut my artery in my forearm right here, I could hit blood on the ceiling. Stand back. No, I'm not going to do that. Okay. Understand, there's a lot of pressure in this. In fact, a resting blood pressure of over 120 millimeters of mercury is common in this. If you're a weightlifter, blood pressure inside of the arteries, it can go as high as 400 over 200. So blood pressure varies to such an extreme amount. Now, if you were to cut the artery in my leg, I could be dead in a minute. There's that much pressure. If I cut the artery in my abdomen, I'm dead in about 10 seconds. So the body has sensors. And in fact, anything that damages the arterial wall, the body's going to protect it. Now, remember we talked about physical, chemical, and emotional stress? Have you ever heard of the good cholesterol and bad cholesterol? Raise your hand if you've heard that term. Okay, if any medical doctor has told you that, fire them. Okay, there's appropriate cholesterol and appropriate cholesterol. There is no good or bad. Okay, anybody that says that is completely ignorant about the function. LDL, low-density lipoprotein, what ignorant physicians call bad, is the precursor to stress hormones, and it's used for tissue repair. So if you have high levels of LDL cholesterol, it means you have tissue damage, number one, or you're under stress. So you need that for tissue repair. So now remember this chart. If you do anything bad for the body, you take a step towards death. You do something good for the body, you take a step towards life. Let's say you have a high-stress lifestyle with tissue damage. You take a drug to force your cholesterol levels down. Does that make you healthier or sicker? Sicker. Absolutely, 100 times out of 100. The problem is, anything that damages the arteries, the body's going to protect. Now, let's say if you smoke cigarettes, or smoke cigarettes when you were a teenager, does that damage arteries? Yes, it does. So the body's going to protect that artery. What if you eat boiled foods, trans fatty acids? What if you eat synthetic foods? What if you eat fast foods? All of those have free radicals in it, and that, again, damages arteries. So the body, in an infinite wisdom, is going to protect those arteries with a combination of cholesterol, fibrin, and calcium. Okay, and that's a protective mechanism of the body. And so this is the body trying to heal itself and keep you alive. So now, if you take away that protective mechanism, any study on the planet shows that lowering cholesterol adds to the length or quality of life? No, not one. But they do show that you will die earlier if you're taking cholesterol medications, but you'll die with lower blood levels of cholesterol. And there's not one study that shows that it decreases plaquing. But understand, if you have arterial damage, is it harder for blood pressure or for blood to go through that opening? Yeah. So what's the body going to have to do if you have long-term arterial damage? It's going to have to elevate blood pressure to keep you alive. Yes or yes? Oh, that makes so much sense. So if you have somebody who has arterial damage and they give a drug to force that blood pressure lower, do you make that person healthier or sicker? Well, let's look at the research. Okay. Now, this is interesting. Older individuals with arteriosclerotic vessels, so those are vessels that are starting to harden and get clogged up, where higher blood pressure is needed to maintain adequate blood flow to the kidneys and other vital organs. Whatever happened to the good old days when a normal systolic was 100 plus your age? They used to say, ma'am, 100 plus your age, so about 140, 150, 160, that's normal. 170 if you're 70 years old, okay? Those are all considered normal because of the damage your arteries may have maintained during your life. So it's a guide. It's just one factor in engaging health. It's not the definitive. Not everybody agrees with this upper limit now, okay? Now it's considered 140 over 90, even for people over 70. So this means everybody should have the same blood pressure? No, that's illogical. That's totally illogical. Nevertheless, some senior citizens will constantly complain of weakness, dizziness, if their blood pressures are lower than 120 over 80, the value that is now recommended. Particularly true for women who tend to have higher blood pressures than men. Now, if you're taking blood pressure medications, guess what the side effect is? Dizziness when you're going from sitting to standing. Okay, fatigue when you're walking upstairs. This means you're compromising blood supply to vital organs if you're over-medicated. But how do you know that? How do you know if you're not getting it? First off, there's 300 risk factors in heart disease. So what do they say? They say high blood pressure is the silent killer. It's linked to heart disease, and it's linked to kidney damage, and it's linked to stroke. Really? Did you know that there's over 300 different factors in heart attacks? And this includes deep earlobe crease, baldness, high selenium levels in toenails, a pot belly, not having a nap a day. All of these have equal risk factors. But you're not going to get a pill that makes you take a nap a day. If there was, I'd be prescribing it. I know. Who would turn down a nap? Okay. This is tough. Listen to this part. No randomized clinical trials have ever been proven that lowering elevated systolic levels to 140 reduces the risk of death of coronary artery disease. There's not one study that shows that you lower blood pressure, it saves you from coronary artery disease. There is a study, however, that I gave you that shows that people with higher blood pressure levels, now this is out of the Journal of the American Medical Association, they took people with coronary artery disease, and they found that if they had lower blood pressure, they died earlier. That if they had higher systolic, a blood pressure of over 161, of course, I know if you're thinking back to that chart off of WebMD, 161 is stage 2 hypertension. But this one says if they have systolic blood pressure of over 161, they had lower death rates. Go on, say it with me. Wow! I didn't know that. That makes sense. So if the arteries are clogged, if there's damage, you might require higher blood pressure to keep you alive. Interesting. Now, here's a patient. You could sit up nice and straight in your chair. You could slide off to the side and imagine that you had a couple of traumas. Okay, take a deep breath. This is harder to breathe. Go back to the middle. Take a deep breath. 5 years of neck pain, 4 years of high blood pressure and high cholesterol. Now remember, there's no such thing as good or bad cholesterol. There's appropriate cholesterol and appropriate cholesterol. If he's under physical, chemical, and emotional stress, his body's producing LDL cholesterol. Plus, in this body posture, is it harder to breathe? Yes or yes? Okay, so that means since the brain burns 90% of the body's oxygen, his heart, or that pump, is going to have to work harder to get oxygen to the brain. Yes or yes? Now, this is the weird part. If we're in a crazy medical world that says everybody should have the same blood pressure, if you have this type of body posture, is your body trying to get higher blood pressure to keep you alive? Yes or yes? Yeah. If you give this person a diuretic or a beta blocker, do you make him healthier or sicker? Sicker. Absolutely, 100% of the time. Here's the same patient 90 days later, no blood pressure medications, normal functioning. And his medical doctor said, wow, I thought you were going to have to be on those drugs the rest of your life.